But how do people know that then? If there's such a powerful force of the old, let's say, the old guardians, and then there's few of, clinics like yours, ours, and others out there. Think about biological dentistry. That's such a small sliver of dentists out there. And at the same time, they're being pushed out and basically ridiculed by convention, and ADA would love to see them go away.
Right.
Do you see that changing anytime soon? Because it's been like this for a long time. People are getting sicker and sicker, even in this day where you have an independent documentary maker making a story about him. It was his story to share with the world, and bringing experts on that are absolutely accredited, know what they're talking about, showing actual research. And yet that could even be shut down. Do you see anything changing in that, where people could actually have access to good information to make better decisions for their health?
Well, it's getting better. I mean,
it is?
With the internet, even with all the censorship that there is, it's getting better. And so, most of the guys that I know that are doing this kind of practice are busier than they've ever been.
It's true.
Because people are learning about this, and they're getting dissatisfied, or they're not getting help from doing the routine things, and they're open and they're looking. And sometimes they come in here and they do a consult with you and they're like, really? Like, wow. And I think one of the biggest, so we use this tool where we use dark field, and, I always do a full physical exam on every person that I see. And in probably 90% of the people that I examine, their physical exam is actually just fine. Their heart is fine, and their lungs are clear, and they don't have swollen lymph nodes, and their liver and their spleen are fine, and their reflexes are fine, and they feel terrible. Now, they've been to 13 doctors who, let's say, did their due diligence, and they did a good physical exam looking for pathology, and they didn't find anything. And then they did routine blood work. They did a panel with CBC and CMP and lipids and the regular normal stuff. And on many of the people that we look at, those look fine too. And that doctor then makes the conclusion that I've got a menopausal woman who's depressed, or I've got somebody who's stressed out. And what they really need is Prozac or Lexapro or one of these drugs, because that's what's wrong with them. And the patient often goes along with that. Okay, I'll take your medicine to see if it'll make me feel better. But then they find that their fatigue isn't any better, and their pain isn't any better, and their bowels aren't any better. And then they're looking, and they get a tremendous amount of invalidation from the medical field that they see, and maybe even from their family or their spouses. And then I see them come in here, and they fill out a symptom survey, and on a possible 200, they got 190. So they've got symptoms in every organ system and valid complaints. And I look at them, and oftentimes they don't look that bad. And their physical exam is just okay. And I review the lab work that they had done, and really there isn't any alarming thing. And then I take a drop of blood from their finger and I put it up on the microscope, and I look at it on the microscope, and it looks absolutely horrendous. Okay? They have biofilms all over their blood, and they got spirochetes swimming around in their blood. I say, you know what? You aren't crazy. You are sick. Look at your blood. And for many of these people, it is like they cry. They cry because they have all this force telling them that they're nuts. And they know that they're not nuts because 5 years before they weren't nuts and they were fine. And they were working hard, and they were taking care of their family, and they were having an enjoyable life. And now they're not. And whether it was a tick bite or, whatever it was that got them. And then that stuff just sort of melts, and then they go better. And then you look at their blood 3 months later, and hey, we don't see all this stuff. It's not there anymore. And you're feeling better. And your symptom score went from 190, and now we're down to 27. And you're sleeping, and you don't have pain, and you feel good, and you're happy. And we didn't do anything that's going to hurt you. None of our treatments are toxic. When you sat in our R&B room for 3 days a week, and you sat in a hyperbaric chamber 5 days a week for a couple of months, and we did these various things which are designed to get your body back to health the way it was supposed to be. And it works about 85% of the time. We win, like we get it. And that's just really good medicine. Those tools are really necessary. And so doctors who want to pursue this field, and the field is wide open. I mean, there's no shortage of patients anywhere, but they have to go off the grid to learn this stuff. When your dad and I started this, there was no grid. I mean, there was no, there wasn't an Institute of Functional Medicine. There wasn't A4M. There wasn't, European Biological Network. There wasn't any of this stuff. We would just go, who's smart? Who's getting results? Okay, go to their seminar. And my wife and I, every month, 1 or 2 weekends, we traveled to go somewhere to learn from some smart guy who had some smart thing. And then, okay, let's put that in the clinic. And then let's put this in the clinic. And and then you build this, this thing where, where now there is some organized education helping people to learn this stuff. And then what they've got to do is really intern in places that know how to do it and can integrate it. And then they can do it.
And, I've always said that the doctors, going into the future now have it easy. You know what I mean? My father was the same way. He had to find people out there, needles in haystacks, and travel to China to learn about acupuncture, work with Amora and others, and do those sort of things. And I was lucky because I got to come along for the ride as a child and go to see these beautiful places. And while he was doing the training out, I'd go and enjoy myself. But that was the thing back then. I feel like to be that pioneer and go out, you had to really work for it. Now you don't. And yet still, I know there are more and more people getting involved in this, and there is a movement towards functional medicine. But I have to say, it's still small minority.
Yes.
It's growing, but I thought it'd be growing a little bit quicker because, again, conventional's approach to chronic disease is not a winning one. We're getting sicker and sicker. What is it? 60+% of us now in America are chronically ill in incurable state and getting worse and worse. And it's just not sustainable.